Welcome. So, in the coming three classes, we'll be dealing with anatomy and you'll be acquainted with all the important topics of anatomy. Now, today, we will be dealing with the arterial system, venous supply, and the nervous system of the entire body. So, coming to the arterial tree, please note it down or you can take a screenshot because I will not be stopping in between. We'll be continuing as it is. So, the first one is the aorta. Now, you can see a picture over here. You can see a picture over here, aortic root, right? Now, we know that from the heart, or we can say the left ventricle, from the left ventricle, the blood is pumped to the aorta. You can see aorta over here. Now, once it is pumped into the aorta, the blood continues in the ascending aorta and then into the aortic arch. Now, into the aortic arch. Now, coming to the aortic arch, it gives three branches. You can see over here, three branches. First one is the innominate artery. Otherwise, you can call it to be a right brachiocephalic artery. Innominate artery and the right brachiocephalic artery is one and the same. Okay. Next one is the left common carotid artery. And thirdly, we have the left subclavian artery. Now, talking about the right subclavian artery, remember, the right subclavian artery is always a branch of the right brachiocephalic artery. Okay, now, this was about the aortic arch. Now remember about the heart. Heart is an organ that receives its own blood from coronary artery. It receives the blood from the coronary artery. Remember this. Okay, now there are two major branches of coronary arteries that comes from the aorta, and that is the right and the left. Now these both arteries, they supply blood to the heart muscle. Okay, all parts of the heart. Now next one. First, coming to the left, we'll discuss about the left coronary artery. The other name for the left coronary artery is the left main trunk. Okay, the other name is the left main trunk. I'll write over here. Left main trunk. Now, the left coronary artery is divided into two, and the branches are the left anterior descending artery and the circumflex artery. Now, talking about the left anterior descending artery, remember, it supplies blood to the front and bottom of the left ventricle and the front of the septum. Remember, it supplies to the left ventricle, which in all part, the front and bottom of the left ventricle. Whereas the circumflex artery, it supplies blood to the left atrium. Remember, it supplies blood to the left atrium, where and all, the side, back, okay, and then to the left ventricle. It supplies blood to the entire left atrium and side, back of the left ventricle. Now, this is what you need to remember. Now, coming to the left anterior descending artery, it again divides into two. There is a septal branch and it gives rise to a diagonal branch also. Whereas circumflex artery, it gives rise to an obtuse marginal branch. Okay, the main thing over here, coronary artery divided into two. Left coronary artery again gives two branches. That is a left ascending descending artery, anterior descending artery, which supplies blood to the left ventricle, that too in the front and the bottom of the left ventricle. Whereas circumflex artery, it supplies blood to the left atrium and the side and the back of the left ventricle. Now coming to the right coronary artery. Now remember, right coronary artery, it enters into the atrioventricular groove and it gives three branches. That is a posterior descending artery, acute marginal artery or right marginal artery, and then coming to the posterior lateroventricular artery. Now remember, the main portion of the right coronary artery provides blood to the right side of the heart. And from there, it pumps to the lungs. That is known. Okay, that's the main portion. Now, the rest of the right coronary artery and its main branch, that is the posterior descending artery, okay, with together with a little of the circumflex artery, it runs across the heart's underside, that is bottom side. Okay, bottom side. Uh, and a little portion of the left ventricle and back of the septum. And that part of at that part of time, what will happen is the posterior descending artery with a little of the circumflex artery together, they will drain. They will run in the beneath the bottom of the heart, and thus it supplies blood to the left ventricle and back of the septum. This is what you need to remember. Okay, so right ventricle from the right coronary artery, little blood, or most importantly, blood goes to the lungs, and the rest, along with the posterior descending artery and the circumflex artery, they will go and supply the left ventricle. Okay, this is what you need to remember in coronary artery. I hope this is clear. Next one, coming to the arterial supply of the upper extremity. Now, the arterial supply to the upper limb is delivered via 5 main arteries or main vessels, you can say. The first one is the subclavian artery. Remember, I'm writing over here, subclavian artery. Second one, axillary artery. Third one, brachial artery. And then we have radial and ulnar arteries. So these are the main arteries or main vessels that supplies to the upper limb. Okay, now first one we'll talk about is the subclavian artery. Now the arterial supply to the upper limb that begins with the subclavian artery. On the right side, I have already said in the previous slide, right subclavian artery is a branch of right brachiocephalic artery. Now, so over here, once again I'll repeat. On the right, the subclavian artery arises from the brachiocephalic trunk, and on the left, it branches directly from the arch of aorta. Now, remember the subclavian artery over here. You can see a right subclavian artery. Now, whatever branches I'm telling over here is same for the right as well as the left subclavian artery. So we'll pick up one. That is the right subclavian artery. Right subclavian artery travels laterally towards the axilla. Okay, so subclavian artery, it travels laterally towards the axilla, and then we can see that it is divided into 3 parts. But which muscle divides into 3? That is more important. That is the scalenus anterior. Now remember, subclavian artery comes down towards laterally towards the axilla, and then it has been divided into 3, and that too by scalenus anterior muscle. The first part is there are 3 branches of it. That is the internal thoracic artery, vertebral artery, and thyrocervical trunk. Okay. Now remember, when I talk about the first part, that means the first part is origin of the subclavian artery to the medial border of the anterior scalene muscle. So remember, first part I'm talking, that is to the medial border of the muscle, medial border. Okay. Now second part, we have only one artery, that is the costocervical trunk, and that is derived from that passes from the posterior to the anterior scalenus muscle. Third part, we have dorsal scapular trunk, and that is from the lateral border. This is important. So subclavian artery is divided into 3 parts by scalenus anterior. The first part is the origin is from the medial border of the anterior scalene artery. Second part, that is the costocervical trunk, and that is having its origin from the posterior to the anterior scalene muscle. And third part, that's the dorsal scapular trunk. Again, it is originated from the lateral border. And remember, this is also to the lateral border of the first rib. Now, coming to a little branches of the thyrocervical trunk, you can see over here, there's a thyrocervical trunk, the first part. And then we have a vertebral artery too. Thyrocervical, we have a vertebral artery. Okay. Now, coming to the second part, we had a costocervical trunk, which is not mentioned over here, and the dorsal scapular artery, not been shown over here. So thyrocervical trunk is again divided into suprascapular, inferior thyroid artery, as well as the transverse cervical artery. Coming to the costocervical trunk, there is a second part, is having two branches, that is superior intercostal muscle, superior intercostal artery, as well as the deep cervical artery. Okay, so these are the little branches. Now, coming to the axillary artery. Now we know that it continues, right? Subclavian artery continues as axillary artery. But what you need to remember is at the lateral border of the first rib, the subclavian artery enters the axilla. At the lateral border of the first rib, subclavian artery enters the axilla, and now the artery, the name of the artery, we tell it to be as a axillary artery. Now, axillary artery lies deep to the pectoralis minor muscle. Okay, and axillary artery is enclosed in a axillary sheath. Now, talking about uh, axillary artery, I already said it lies deep to the pectoralis minor. Right now, pectoralis minor divides the axillary artery into three parts. The first part, now this I'll write over here. The first part, or the first is the artery which contains the first part is the superior thoracic artery. Remember, superior thoracic artery, and that lies proximal to the pectoralis minor. Second part, we have two branches, there's a lateral thoracic artery and a thoracoacromial artery. Remember, that lies posterior to the pectoralis minor. And third part, we have three, that's the subscapular artery, posterior humeral circumflex artery, and anterior humeral circumflex artery. So you can see over here the arteries over here. That's the humeral circumflex arteries. One goes to the anterior, other one goes to the posterior part. Okay, now remember, it has its origin from the distal to the pectoralis minor. You have to remember this. The first part of the subclavian artery comes from which and all part, and all the parts from the axillary artery comes from which part. This is important to remember. Now, coming downwards, that is, the axillary artery then continues to become the brachial artery, and that too, it is in the lower border of the teres major muscle. Remember this. As the axillary artery, crosses the teres major muscle, that with the lower border, we name it to be a brachial artery. Now, remember the brachial artery, that I already mentioned, it's a continuation of the axillary artery. Now, it supplies, or the main supply is to the arm. Arm is the main part of it supplies. Now, immediately distal to the teres major muscle, the brachial artery gives rise to profunda brachial artery. This is a little deeper one. It's a deep artery. Okay. Now, there is one more branch, and that is a ulnar collateral artery. Now, ulnar collateral artery, it is again divided into two. That's a superior ulnar collateral artery and an inferior ulnar collateral artery. Remember this. Now, coming to the continuation of the brachial artery, now it comes down. Remember, if you can look over here, it comes down and then it divides into two. Now, where it divides into two, that is just, you can see over here, this part, right? Over here, and which is the part over here, we have a cubital fossa. Now, brachial artery descends down the arm, and as it moves through the cubital fossa, underneath the bicipital aponeurosis, there it terminates into or bifurcates into two. There's a radial on the lateral side and ulnar artery on the medial side. Okay, now coming to the radial artery. Now remember, radial artery supplies to the posterior lateral aspect of the forearm. Posterior lateral aspect of the forearm. Okay, now we know that there is a clinical importance of radial artery, that is the radial pulse. Radial pulse can be palpated in the distal forearm, immediately lateral to the prominent tendon. And on which tendon? The tendon of the flexor carpi radialis muscle. Now coming to the ulnar artery, it supplies to the anterior medial. You know that radial artery I just mentioned, it is the posterior lateral, and ulnar artery is the anterior medial aspect of the forearm. Okay. Now, coming to the ulnar artery, it gives two branches, that is a deep ulnar artery and a superficial ulnar artery. Talking about deep ulnar artery, remember, okay, before that, I'll talk about the superficial first. Superficial, as it goes, you can see over here. As the superficial ulnar artery comes, we have a superficial palmar arch over here, and which gives rise to digital palmar arteries. You can see digital palmar arteries. And that in turn gives rise to proper digital arteries. Proper digital arteries. Okay, now coming to the radial one. The radial artery over here gives rise to a deep palmar arch, or not gives rise to it, it comes in contact with deep palmar arch. It forms a deep palmar arch. And from the deep palmar arch, we have two. One is the princeps polliceps artery, and the other one is the radialis indicis artery. Radialis indicis artery. Now, this deep palmar arch and the deep ulnar branch of the artery, okay, these two have a connection. Okay, so this was about the arterial supply to the upper limb. Now, with regards to the arterial supply of the upper limb, one thing which has been asked in the previous examinations are the branches of subclavian artery and where does it supply to. So remember, we have vertebral artery, it supplies to the brain. Internal thoracic artery, it supplies to thorax. Thyrocervical artery supplies to the thyroid gland and cervical region. And then we have a costocervical artery, which supplies the ribs and the neck. Okay. And lastly, we have a dorsal scapular artery, which supplies behind the scapula. This is very important. I repeat it once again. Vertebral artery supplies to the brain. Internal thoracic artery to the thorax. Thyrocervical artery, divided into two, thyroid gland and the cervical region. Costocervical artery, there is a costo, that is the ribs and that of the neck. The next one is a dorsal scapular artery, that is behind the scapula. This is very important. It was being asked in the exams again and again. Now we'll move forward. Now, we have already mentioned over here, you can see over here, the first one. We had already mentioned about the left common carotid artery, right? Now we'll see what happens with the left common carotid artery. The common carotid artery. We divide the common carotid artery into two. There is an external carotid artery and an internal carotid artery. You can see over here, right? This is the common carotid artery. It divides into two. External carotid artery and an internal carotid artery. Now, first we'll talk about the external carotid artery. The external carotid artery, we are not talking, showing the deeper branches over here. Okay, so the first one is anterior, then we have a medial or deep, then we have a posterior, we have a maxillary artery, as well as a superficial temporal artery. You can see over here. We have a superficial temporal artery over here. Then we have a maxillary artery, so you can see it is going behind that of the mandible. Then we have a posterior, then that is posterior, it divides into an occipital artery and a posterior auricular. You can see over here. There is a posterior auricular artery, as well as we have a occipital artery which supplies or goes to the occiput. Then we have a medial and deep, which is having one branch, that is the ascending pharyngeal artery, which is not being shown over here. And then we have an anterior external carotid artery, which anterior branch, which again divides into facial artery, supplies to the face. Then you can see our facial artery over here. Okay. Then we have a lingual artery that is, let's see, inside. Okay. Then we have a superior thyroid artery. You can see it is going and supplying the thyroid gland. So superior thyroid artery. So this is what you need to remember about the external carotid artery. Now, a very important part of common carotid artery is the internal carotid artery. Okay. Now, it is clearly mentioned. You can see this picture. Now we have an internal carotid artery over here. Okay. Internal carotid artery. The branches are not actually shown properly, but remember it has 4 branches. It has 4 parts. There's a cervical part, a petrous part, a cavernous part, and a cerebral part. Okay, now the one which you need to remember in internal carotid artery is that what forms the circle of Willis. Now remember, this is a circle of Willis, right? And the part which I have marked in uh, blue, there is a part of internal carotid artery. So remember, whenever we talk about it, we have, now what we have it over here is internal carotid artery, and then you can see this is a circle. This is a circle of Willis, and what are its or what forms the circle of Willis? The first one is the internal carotid artery. Second one is a posterior communicating artery. Remember, posterior communicating artery on both the sides. Then we have a posterior cerebral artery. We have a posterior cerebral artery. Then we have a anterior cerebral artery, and we have an anterior communicating artery. So these are the 5 things with which a circle of Willis is formed. This becomes very important, and you should know it. Okay, in this, one more thing which you need to remember is what are the branches of internal carotid artery. Now you can see over here we have a middle cerebral artery, right? Middle cerebral artery is one of the branch of internal carotid artery. I'll change the color so that you will understand. Okay. Now internal carotid artery, first branch is middle cerebral artery. The second one is the anterior cerebral artery. Okay. Third one is the posterior communicating artery. Third one is a posterior communicating artery. And then we have a ophthalmic artery. You can see over here, this is ophthalmic artery. That is again a branch of internal carotid artery. And we have a anterior choroidal artery. You can see anterior choroidal artery. So we have namely 5 branches: middle cerebral artery, anterior cerebral artery, posterior communicating artery, uh, ophthalmic artery, as well as the anterior choroidal artery. Okay, now you can see over here vertebral artery. If you remember the previous slide, over here we had mentioned about vertebral artery being a part of subclavian artery, right? Now we'll talk about vertebral artery. Now you can remember vertebral artery over here. Now vertebral artery, 2 vertebral arteries come and they become the basilar artery. Now here you need to know the divisions of basilar artery. So the first one is the anterior inferior cerebral artery. Again, change the color so that you can understand. Okay. Basal artery, it divides into anterior inferior cerebellar artery. Then we have a superior cerebellar artery. We have a posterior cerebral artery. And we have pontine branches. Okay, so these are the branches of basal artery. So the internal carotid artery branches as well as the basal artery branches together, it forms the circle of Willis. Okay, so this is what you need to remember. So which are the branches of internal carotid artery which helps in the formation of circle of Willis? That is the middle cerebral artery, anterior cerebral artery, and the posterior communicating artery. And now which are the basal branches that help? That is the anterior, superior, as a posterior cerebral artery. Okay, these are the things which helps in the formation of circle of Willis. So the next one, we'll go to the descending thoracic aorta. Okay, now come to the descending thoracic aorta, or you can just say it to be a thoracic aorta. The thing which you need to remember that is it starts from the level of T4 and it ends at T12 at the aortic hiatus. Okay, now this is one thing which you need to remember. And once it leaves the aortic through the aortic hiatus, that is at the diaphragm level, and then we call it to be a abdominal aorta. Okay, important thing. It starts at the level of T4, ends at the level of T12 at the aortic hiatus and in the diaphragm, that is placed in the diaphragm, and from then on we term it to be a abdominal aorta. Now coming to the branches, we'll see it from the first one is the 9 pairs of posterior intercostal artery. You can see over here we have posterior intercostal arteries. We have 9 pairs. Okay, let's start from the T3 till T11. So 1, 2, 3, 4, 5, 6, 7, 8, 9. We have 9 pairs. Okay, of posterior intercostal arteries. Now remember, these are the small paired kind of arteries, and these supply the intercostal spaces. I'll just write. It supplies the intercostal spaces. Okay. Now, with the exception of the first and the second, this one you need to remember. The next one we're talking about is the subcostal arteries. Okay, subcostal arteries over here. You can see we have a subcostal artery over here. Okay. Next one is the superior phrenic artery. The next branch is the superior phrenic artery. Then we have a esophageal artery, and remember this is an unpaired one. Esophageal artery is unpaired. Okay, the branches arising from the anterior. You can see over here, esophageal, that is anterior part, and it supplies to the esophagus, as the name goes. Then we have a mediastinal arteries. You can see over here, mediastinal arteries over here, and this together becomes a mediastinal artery. And now what it supplies? It supplies the lymph gland. Remember, it supplies the lymph gland and use areolar tissue in the posterior part of the mediastinum. I repeat, it supplies the lymph gland and loose areolar tissue in the posterior mediastinum. Okay, next one we have a bronchial artery, which again is having a right and a left branch. You can see over here, bronchial artery. Okay, now talking about bronchial artery, remember this is a paired one. It arises from the lateral part and it supplies the bronchial. Remember, it supplies the bronchial and peribronchial tissue. Okay, plus supplies the visceral pleura. These are the 3 things which it supplies. Okay, so bronchial artery, it supplies the bronchial tissues, peribronchial tissue, as well as the visceral pleura. So these are the 3 things which it supplies. Lastly, we have a pericardial arteries. Now, these are the small pericardial, small unpaired. Again, these are the small unpaired arteries. You can see over here. Pericardial arteries, the small unpaired artery that arise anteriorly, and that supplies what? It supplies the dorsal portion of the pericardium. Remember, it supplies the dorsal portion of pericardium. Okay, so this is the blood supply, especially about the descending thoracic aorta. I hope this is clear. Next one, coming to the abdominal aorta. Now, talking about abdominal aorta, you need to remember 2 things. There are paired and there are unpaired arteries. Paired I have marked over here. The first one, paired one, you need to remember is inferior phrenic artery. Then we have a middle suprarenal artery. Then we have renal artery, gonadal artery, as well as the lumbar artery. Okay, these are the paired ones. Unpaired ones, we have a celiac trunk. We have a superior mesenteric, that is the anterior part you can see over here. Superior mesenteric, and we have a inferior mesenteric. These are the paired as well as the unpaired ones. Now, about abdominal aorta, one thing you need to remember is that it is a continuation of the thoracic aorta and it begins at the level of T12. But one more extra information you need to know, it is approximately 13 centimeter long. Okay, and where does it end? It ends at the level of L4 vertebra. Okay, it ends at the L4 level of the vertebra. Now, the first one you need to remember is about the unpaired ones. Unpaired ones are divided into celiac trunk. It's divided into superior mesenteric artery, and we have a inferior mesenteric artery. Now, remember, we'll be dealing with about each and everything in the upcoming slides. So, these are the first one. There is a unpaired ones, that is celiac trunk. We have a superior mesenteric artery and inferior mesenteric artery. Remember where it starts, T12, L1 and L3. This becomes very important. You can see over here, celiac trunk, it starts at T12. Then we have a superior mesenteric artery, starts at L1. And lastly, we have an inferior mesenteric artery, and that is the level of L3. This is very important. Okay. Now, coming to just about the paired branches of abdominal aorta. The first one we have it is inferior phrenic artery. Okay. Now, coming to the inferior phrenic artery, it is a paired one, and remember it arises at the level of T12, that is posteriorly at the level of T12. And where do they supply? They supply to the diaphragm. Remember, they supply the diaphragm. Okay. Now, there is one more artery which comes along with the inferior phrenic artery, and that is a superior suprarenal artery. Superior suprarenal artery. The next one we will talk about is the middle suprarenal artery. Now, these again are the paired ones, and it arises posteriorly in the L1 vertebra. Okay, and what does it supply? It supplies to the adrenal gland. You can see over here, we have adrenal gland over here. Inferior phrenic artery we have. Okay, so, so suprarenal arteries, you can see suprarenal arteries. Okay, we have a superior suprarenal artery, we have an inferior suprarenal artery, and we have a middle suprarenal artery. All the three will supply the adrenal gland. So next one is the renal artery. Now, this one actually starts in between the level of L1 and L2. It starts in between L1 and L2. And where does it supply? It supplies kidney. Okay, and remember, inferior suprarenal artery is a branch of a renal artery. Okay, you can see over here. I already mentioned there's an inferior suprarenal artery. Where does it come from? It comes from the renal artery. Okay. Now, next one is gonadal artery. Gonadal artery, when we talk about, you need to remember it arises from L2 level of L2. And in male, we have a testicular artery, and in females, we refer it to be a ovarian artery. Apart from this, we have lumbar arteries, and that to 4 in number. You can see 1, 2, they are 4. Okay, they are 4 pairs, 1, 2, 3, and 4. Now, these lumbar arteries, the paired ones, they arise from the posterior lateral level, posterior lateral part at the level between L4, L1 and L4. So in between L1 and L4 it arises. This is very important to know. And where does it supply? It supplies the abdominal wall and it supplies the spinal cord. So these are the two things which it supplies. Okay, so these are the main branches of abdominal aorta, the paired ones. One more thing which you need to remember is about an unpaired one, and that is the median sacral artery. See, it comes as a just one line. That is a median sacral artery. Now remember, there is an unpaired one and it arises posteriorly, that is behind it, at the L4 level. It's already mentioned over here, L4 level. Okay, and where does it supply? It supplies the coccyx, it supplies the sacrum, as well as lumbar vertebra. So these are the three things or three places where it supplies. So this was about the paired branches of abdominal aorta. Now in detail we'll see about the unpaired ones, that is celiac trunk, superior mesenteric artery and inferior mesenteric artery. About the celiac trunk, I have already mentioned over here. It starts at the level of T12. Now coming directly to the branches. So now we have a celiac trunk over here. I'm marking the celiac trunk in green. Okay, now from here we have branches. The first one is the left gastric artery. We have a splenic artery and a common hepatic artery. Okay, you can see we have a common hepatic artery over here. Okay, then we have a splenic artery. Okay, and then we have a gastric artery. Now, coming to the splenic artery, you can see splenic artery over here. Now, in splenic artery, there is one branch which is not shown. One branch is coming over here, and that is a pancreatic artery. Okay, other branches are, see over here, the splenic artery comes and divides, right? And that is, it divides into short gastric artery. Now, as the short gastric artery, as it goes, it enters into the spleen, and that is what we call to be a hilar artery. And now, one more branch that goes, the beneath the stomach, and that is the left gastroepiploic artery. So this is about the splenic artery. I repeat, splenic artery divides into a pancreatic branch. It has, next one is a short gastric arteries. Then we have a hilar arteries as well as a left gastroepiploic artery. So coming to the left gastric artery is divided into gastric artery and esophageal artery. That's not shown in this picture. Okay, next one is about the common hepatic artery. Talking about the common hepatic artery, remember it is divided into a proper hepatic artery, you can see proper hepatic artery. Then one more branch is, one more comes here, that is the right gastric artery. And then one more branch, we have it over here, that is the gastroduodenal artery. Now coming to the right gastric artery, remember it runs along the lesser curvature of the stomach. It runs along the lesser curvature of stomach. This one. You can see lesser curvature, it will run over here. Coming to the gastroduodenal artery, it is divided into two. One is a supraduodenal artery, you can see one branch, and the other one goes as right gastroepiploic artery. Right gastroepiploic artery. We had a left gastroepiploic artery which arises from the splenic artery, and we have a right gastroepiploic artery which is arising from the gastroduodenal artery. And lastly, we have a proper hepatic artery. Now, proper hepatic artery is divided into two. That is a right hepatic artery, and we have a left hepatic artery. Now, from the right hepatic artery, it again divides into a cystic artery. So, this is about the celiac trunk. Now, coming to the superior mesenteric artery. Yeah. So, the first one, superior mesenteric artery, you can see over here, right? Superior mesenteric artery. Now, it is divided into an inferior pancreaduodenal artery. Okay, it is not shown here. Then we have a jejunal artery. We have an iliac artery, middle colic artery, right colic artery, and an ileocolic artery. Okay. An ileocolic artery is divided into anterior cecal artery and a posterior cecal artery. So these are the branches of superior mesenteric artery. As the name goes, it applies to that particular part. Inferior pancreaduodenal artery, we have a jejunal artery, iliac artery, middle colic artery, right colic artery, and ileocolic artery. Now, what about the rest parts that has been supplied by the inferior mesenteric artery? So, inferior mesenteric artery, you can see that will go and supply the left colon, then sigmoid artery, and the superior rectal artery. So, these are the three branches of inferior mesenteric artery. Okay. Now, I have already mentioned superior mesenteric artery. It starts at the level of L1, and inferior mesenteric artery, it starts at the level of L3. This is very important to know. Okay. So, this was about the abdominal aorta. Now, coming to the common iliac artery. Now, over here, you can see the picture. At the level of L4, the abdominal aorta, right? Abdominal aorta will become a common iliac artery that will be again dividing into a left common iliac artery and a right common iliac artery. So, the same thing goes over here. So the common iliac artery divides into internal iliac artery and we have an external iliac artery. Okay. Now, coming over here, external iliac artery, it is divided into, or it gives two branches, main branches, that is inferior epigastric artery and we have a deep circumflex artery. Okay, inferior epigastric artery and a deep circumflex artery. You can see a picture over here. Okay, this is a inguinal ligament. Okay, the one, okay, I'll mark over here. This is an inguinal ligament. Before the inguinal ligament, it will give two branches. That is, one is deep circumflex iliac artery and the other one is inferior. You can see over here, inferior epigastric artery. Now, after that, it passes beneath the inguinal ligament. And now it continues as a common femoral artery. Now, from the common femoral artery, it again gives some branches. First one is a superficial epigastric artery. You can see over here, the first one, superficial epigastric artery. Next one, it gives rise to superficial circumflex iliac artery. Okay, next one, superficial external pudendal artery. Then we have a deep external pudendal artery. And then we have a profunda femoris. Okay, now in that again, we have four perforators. Then we have lateral circumflex femoral artery. You can see lateral circumflex femoral artery over here. Then we have a medial circumflex femoral artery. Okay, so these are the things. As it goes, then it continues as the superficial femoral artery. This is how the branch goes of an external iliac artery. Now coming to the internal iliac artery, it has a anterior division, and it has a posterior division. So talking about the anterior division, it is divided into an umbilical artery. Remember, it is divided into an umbilical artery, and superficial vesicular artery arises from this particular part. Okay, now next one is an obturator artery. You can see obturator artery. Then we have an inferior vesical artery in male and vaginal artery in female. You can see over here. This is the inferior vesical artery or a vaginal artery. Next one, we have an internal pudendal artery. You can see internal pudendal artery. Remember, these are the branches of the inferior anterior division. Okay. Then we have an inferior gluteal artery, again arising from the anterior division. Then we have a middle rectal artery, middle rectal over here, and we have a uterine artery. Okay, so uterine artery is again here. So these are the branches of the anterior division of the, you can see away umbilical artery. We have umbilical artery from where the superior vesical artery is arising. So these are the branches of anterior division of the internal iliac artery. Now the posterior division we'll see. You can see this is anterior. We have the posterior over here. Now when we talk about the posterior one, we have a iliolumbar first one. See over here. First one is iliolumbar. Then we have a laterosacral artery and we have a superior gluteal artery. So these are the branches of the common iliac artery. I repeat, internal iliac artery and external iliac artery. Okay, before passing beneath the inguinal ligament, external iliac artery gives rise to inferior epigastric and deep circumflex. So common femoral artery is termed only after the external iliac artery passes beneath the inguinal artery, sorry, inguinal ligament. So this is about the common iliac artery. Now next one is apply to the lower limb. Okay, this is very easy. Yeah. Okay, now already we spoke about a superficial femoral artery, right? Let's continue with it. Now, a superficial femoral artery, when it descends, okay, when it descends, it gives to one branch. That is the descending genicular artery. Remember, it gives rise to descending genicular artery. And remember, that is before it crosses the hiatus magnus. Now, once it crosses the hiatus magnus, it comes as a popliteal artery. Okay, I hope this is clear. First one, we have a superficial femoral artery. Once it crosses the hiatus magnus, it becomes a popliteal artery. Now, popliteal artery gives rise to two. That's a tibio-peroneal trunk and the anterior tibial artery. You can see over here the anterior tibial artery. Okay. Now, anterior tibial artery that that runs on the anterior aspect of the ankle joint. Anterior aspect of the ankle joint. You can see over here, and then it gives rise to dorsalis pedis artery. It gives rise to dorsalis pedis artery, and this dorsalis pedis artery will ultimately form the deep palmar arteries. Okay, deep palmar arteries. Not palmar, sorry, plantar arteries. Deep plantar arteries, which is again going and helping in the formation of plantar arch. And remember, from the plantar arch, we have again, digital arteries coming up. Okay. Now, sorry, here I have not mentioned the way. Now, next one is a tibio-peroneal trunk. Now, they again divide into a posterior tibial artery, and a peroneal artery. Peroneal artery, other name is a fibular artery. Okay. The other name for peroneal artery is a fibular artery. So, tibio-peroneal trunk gives rise to posterior tibial artery and fibular artery. Now, posterior tibial artery, it passes posterior to the medial malleolus. You can see over here. Passes posterior to the medial malleolus and gives rise to medial plantar artery. Okay, medial plantar artery as well as a lateral plantar artery. Two branches you can see. Medial plantar artery as well as a lateral plantar artery. These two again will help in the formation of a plantar arch. And again, plantar arch, after that we have the digital arteries. Okay, so this is about the arterial supply to the lower limb. I hope this is clear. It starts from the superficial femoral artery. Thus, we have finished the arterial tree of the entire body. You need to revise it once again so that it will stay in your mind.